Affordability is the chief component of this reform. Second, of course, is accessibility. To make it accessible so that you can actually purchase it. If it's affordable and if it offers you good coverage, then chances are you'll try to buy a policy. Affordability, accessibility, choice. One of the things we've heard most from Americans is that you really don't have a lot of choices. Whether it's the insurance plans that you can choose from or what the insurance plans offer you. At the end of the day, most people tell it's too expensive. Whether it's that plan or this plan, it's too expensive. Or even if you're on Medicare, some people tell us it's becoming too expensive even on Medicare. And so what we're trying to do is make sure that making it affordable, but also making sure there's choice so that competition will give you a chance to get the best price, but at your choice. And so that if we make it so that there's a lot of competition, your selection will drive the price because hopefully you'll be smart. You'll go to the best price or the best policy at the best price. You combine all that, and what you end up having is a program that does a couple of things. On Medicare, for example, many of you aren't on Medicare, but for those who are on Medicare, you'll understand this. There's on the prescription drug policies, there's something called the donut hole. You get coverage to help pay for the cost of your prescription drugs, but after you reach a certain amount of spending, all of a sudden the government support to help you pay for that goes away completely, and it's all up to you out of pocket to pay for the cost of your drugs thereafter until you reach another high point, and in which case then the help from the government kicks in to help pay for the costs. That gap of coverage is what we call the donut hole. This legislation, at least in the House, the Senate doesn't have this. In the House, we would move to close that donut hole of coverage so that seniors wouldn't have to pay out of pocket for their completely for their medicines. Right now, there's a match up to a certain point, government support. This would continue that government support so that individuals wouldn't all of a sudden find that they have to pay these high prices for these prescription drugs when they are on fixed incomes as seniors. Two, have you all heard about this whole issue of insurance discrimination based on pre-existing condition? You find out you have a condition, diabetes, congenital heart failure. You didn't know about it, neither did the insurance company, but all of a sudden, boom, it's discovered. Well, all of a sudden, if you happen to lose your job or lose your insurance for whatever reason, it's very difficult to now get reinsured. Why? Because the insurance company say, we don't want to cover you anymore because you have a pre-existing condition, or we won't at least cover any part of your health care that is related to that. And so we propose in this legislation to prohibit policies, offering policies that would preclude those with pre-existing conditions from being able to get them. So we would eliminate the pre-existing condition as a factor used by the insurance companies to determine whether they will sell you a policy. Portability. You need to move. Your job requires you to move somewhere else. Well, the insurer doesn't cover people who live in that state that you need to move to for your job. So all of a sudden you lose your insurance and you can't find a good or decent price policy in that new location. We will make it so that your insurance policy is portable. You can take it with you. So in essence, we're trying to eliminate all the practices in the insurance industry that discriminate against people based on a pre-existing condition, the need to move, portability. Believe it or not, the women in this room, if you're the same age as a man in this room, you pay more for insurance than the man does. We're going to eliminate discrimination based on gender so that it wouldn't be based on your gender but on your health that you are. We determine what you would pay for an insurance policy. And all those things would help in terms of the affordability. In terms of the accessibility, what we're going to do is what you've heard talked about as this exchange, this marketplace. What the legislation would do is, in essence, create think of it as an open market. The government would subsidize individuals who don't currently have insurance, and employers would be required to also subsidize individuals who aren't getting insurance from them. And with that subsidy, an individual who currently is uninsured would be able to go into this marketplace where insurers would all be able to come in and say, this is the plan I offer. It's like going into an open market. You get to look at all the plans that are offered, and then you can buy from there. The attraction is that every individual, at least in the House legislation, would be required to have insurance, the way you're required to have auto insurance. So the insurance industry is interested in participating in this marketplace because they know, there are 50 million new customers. They must buy insurance. So they go into this exchange, they shop around. Insurers will try to compete, hopefully, to offer you the best price because there's 50 million customers, or 30 to 50 million, depending on how quickly we can ramp this up. One of the other issues you've heard about on healthcare, and I'm going to stop with this last point, is this discussion about a public option within this marketplace. The public option is simply this. Among the different options that you as an individual without insurance would have to purchase an insurance policy, health insurance policy for yourself and for your family, as you walk around the marketplace to find out what Aetna, what Blue Cross, what all these different Kaiser offer, there would be one policy like Medicare that would be government administered like Medicare, and it would use private doctors like Medicare, it would use private hospitals like Medicare, but it would be administered through the government like Medicare. The difference is Medicare doesn't try to make profit, and so therefore we don't have to worry about the executive bonuses and all the things that are required to run a for-profit enterprise, and therefore the cost, it's believed, would be less to offer you a policy for health insurance. That would be one of the many options that anyone could choose. The choice would be yours. You would shop around and make a decision. Some people have claimed that this public option would translate into a government takeover of the healthcare industry. Of course it wouldn't. It would be one option of many, and it's just an option. And whether you are in the public option, like Medicare, is up to you. And so it wouldn't be a government takeover. It also wouldn't be a very complete policy in and of itself, because it wouldn't take the entire segment of uninsured people and offer them services unless everyone decided they wanted to go there. But again, the choice would be up to the consumer.